Hello to everyone joining us today, and welcome to this C20 Civil Society Summit side event organised by the Action for Animal Health Coalition. Before we begin, I'd like to give you a little bit of background to this event today. My name is Ellie and I'm the Senior Coordinator for the Coalition, which is currently hosted by Brooke. We are a group of 12 organisations, who you can see on the slide here, advocating for better investment in animal health systems in order to operationalise One Health and to support the attainment of the Sustainable Development Goals. A One Health approach, which recognises the interconnectedness between humans, animals and our planet, has been embraced at this year's G20 as a way to combat global health challenges such as zoonotic diseases like COVID-19 and antimicrobial resistance. But if we're serious about putting the concept into practice, animal health systems across the world will need significant investment to be able to participate effectively. In practice, this means increasing and upskilling the animal health workforce globally, improving access to safe medicines and vaccines for animals, ensuring even the remotest animal-owning communities have access to animal health services, and strengthening early warning disease surveillance systems that are effective from the community level upwards. We are very lucky to have an amazing group of speakers with us today who will discuss the importance of animal health to One Health. We're also very lucky to have Juan Lubroth moderating this event, who is a vet and biologist, has worked for the US Department of Agriculture, the Pan American Health Organization, the UN, and was previously Chief Veterinary Officer of the FAO. And on that note, I will hand you over to Dr. Lubroth to start the discussion. Thank you very much.
Thank you very much, Ellie, and welcome to all to the Operationalizing One Health, making the case for animal health and welfare, and the role that civil society organizations have in directing our politicians and financiers in improving global health. I am Juan Lubroth, your moderator, and honored to be collaborating with the World Veterinary Association, one of the partners of the Action for Animal Health Coalition. I inform you that this session is being recorded, and I also invite you, with the inputs from the speakers, that if you do have questions, that you do use the Q&A function at the screen. And please let me know, as our time together happens, if this particular question is being directed to one of our salient speakers. Our health and that of our planet is critical to the future of our children's children. Yet our priorities are not well aligned with our needs as a family and as a community, whether this is local or global. Our discussion and speakers today are focused on the importance of the voice of civil society to further influence the decision makers. One Health encompasses many facets, and today we are focused on the contribution that animal health has in human health, as well as environmental health, biodiversity, and a robust planet. We must remember that we, as humans, are just one of many terrestrial mammals in this regard. And in this regard, we share common risks, but have a cognizant responsibility to ensure a healthy future to those around us, including plants, rivers, oceans, the air, and in the food we consume. We need to build support for more investment in animal health systems that work for people, animals, and the planet. Today, we have 5 prominent speakers that will address the importance of animal health in our daily lives at the global and at the local level. We begin with our keynote speaker, Dr. Keith Sumption from the Food and Agriculture Organization of the United Nations, who will address us from Rome. Dr. Sumption, besides being the Chief Veterinary Officer of the United Nations, is a disease ecologist with vast experience around the world. This keynote will be followed by 4 interventions by our panelists. Dr. Osman Dar, consultant in the Global Public Health, UK's Health Security Agency, and also director of the One Health project at Chatham House. He's also a member of the One Health high-level expert panel and will be speaking to us from London. Dr. Anthony Akunzule, executive director of the Ghana Poultry Network and currently working with Veterinarians Without Borders Canada. Professor Prasad, former head of the Department of Animal Biotechnology, who will be speaking to us from India, and Mr. Naeem Abbas, Advocacy and Policy Manager at the Brook in Pakistan, working with government, civil society, academia, and donor agencies in prioritizing animal welfare. The first two speakers will provide an overview of One Health and the importance of animal health system strengthening, followed by two presentations on case studies of One Health in action. So I welcome Dr. Assumption to provide insights on the transformative potential of One Health and why robust animal health systems are critical to putting it into practice. Thank you. Dr. Assumption.
Thank you very much indeed for this invitation to this really important event. So thank you for giving me the opportunity. FAO is currently the rotating chair of the tripartite FAO, WHO, and the OIE, and working closely with UNEP to develop a global plan of action for One Health in support of the transformation of our agri-food systems towards ones which will be leading to sustainable global and planetary health. So this is a critical moment for global health. Later this month, the G20 leaders will meet, and their decisions on the financing of actions to strengthen global health security, including on the position of One Health as a priority for a future global health and finance board, have the highest significance for our health, that of our food systems, of our animals, and the shared environment. The case for One Health we've been making clearly this year, and it's been very good to see how the presidency and the G20 members have understood and supported the concept of One Health so far in 2021. But critical decisions lie ahead. Will the future funding and financing priorities give adequate attention to animal health, to healthy food production systems, and to safeguarding the environment in which we all live? And I want to make 3 points relating to that today. Firstly, there can be no health security without One Health. It's essential our leaders give an equal recognition to the importance of animal health and environmental health in the health security agenda. So why is animal health such a critical part of One Health, even of planetary health? With around 4 billion domesticated ruminants, 2 billion other domesticated animals and companion animals, there are actually slightly more people than there are animals under their care in this context. But if we add in poultry, then we have around 4 birds per human on the planet. Compared to plants, humans and animals are remarkably alike, including in the shared susceptibility to infection. Almost all of these animals are dependent on human keepers, cannot make their own health choices. Their health is dependent on our human choices, how they're kept, fed, their environment, their exposure to stress, and for all of their health care. Compared to human health, we have almost no international targets in animal health, with the exception perhaps of the eradication of pest to pity ruminants. We've largely accepted the burden of ill health in animals and considered that spending over $40 billion annually by animal owners as a situation that is normal in our sector. But consider this, ill health in animals damages more than animals alone. It has profound environmental consequences. Ruminants produce 1/3 of the global methane emissions attributable to human activities. Animal health matters. If we reduce disease, we can have a positive environmental impact. Consider also that the volume and quantities of antimicrobial use in many countries in animals exceeds that in humans in terms of quantity per unit biomass. Our international efforts against antimicrobial resistance will flounder unless there's a real change, with animal owners joining in the fight against AMR, armed with information, guidance, and alternatives to ensure that animal health is possible at their level and they can make a positive choice for health rather than treatment. Yes, of course, animals are the source of zoonotic diseases and potential zoonotic pandemics. There will be no human health security without animal health systems that are able to prevent, detect, and respond to these threats. Yes, we can build very sophisticated ways of detecting these infections, but we must also improve animal health as a whole to avoid the silent pandemic of AMR, to make every animal production unit as far as possible efficient and climate positive. Second, what do we need to happen? Currently, COVID-19 and preventing future pandemics is topmost in the international health agenda. The G20 are considering establishing a board with the purpose of ensuring the world has the systems in place to prevent, prepare, and respond, to support the World Health Organization and its member countries, to improve health systems, and to be able to act quickly in the case of a new pandemic threat. The tripartite, WHO, FAO, and OIE with UNEP are developing a global plan of action for One Health. This goes far beyond pandemic prevention, with 6 priority areas for action. We've also established this year the One Health high-level expert panel to give guidance to these joint global programs. What is needed now is to ensure the G20 leaders place One Health as an essential priority for future financing, and that we form a new multidisciplinary way of working together at national level to promote, support the implementation of One Health. A whole shift in behavior needs to happen. Major incentives must be there to achieve change. The opportunity is opening to properly finance One Health as part of strengthening national health systems. We need our global leaders to argue for One Health and to commit to adequate funding for One Health as part of the billions that need to be invested annually to strengthen health security. Estimates are that between $15 and $35 billion are needed annually to strengthen health systems. There's real potential for our leaders to commit to this level of funding. But they need to be persuaded that animal health, One Health, is essential to the outcome. So One Health, we would argue, needs a seat at this new board for financing of health. Finally, what can we do individually in this setting? One Health thinking is something that everyone can practice, considering how each action we take affects our health, affects animal health, and the common environment. One Health is all of our responsibilities. Animal keeping has consequences. In an animal health system, everyone keeping animals can contribute positively or negatively to the health of others or to the health of the environment. Animals cannot ask for health. It's our responsibility to provide it. Yesterday, we had a global youth event on the One Health future we want, in which youth made it very clear that it is the I question we have to ask. What can I do in this setting? Not just what will they do as a result. What can we do now? We need to ensure our global leaders act in the knowledge that animal health matters to the planet and is central to health security. We need to ensure a global discussion with youth and the future leaders of communities on applying One Health in every setting. And we need to engage in a global discussion on how to make One Health work at the individual level, at livestock keeper and upwards. So this is a part of that discussion. We welcome it, and we encourage this discussion to move forward and civil society to play its role and to have its voice. Thank you.
Fortunately, I think Juan may have dropped off the call, possibly, who is our moderator for today. So I'd like to say thank you very much to Keith for your opening speech. It's very insightful. And I think whilst we're waiting for Juan to rejoin the call, we will move on to our next speaker, who is Dr. Osman Dar. Please, Osman, the floor is yours.
Thank you, everyone. And it's great to be here discussing these issues, because I think, you know, we're seeing increasingly that this is important, where the world's coming together, the understanding around how the interconnectedness of humans, animals, and the environment is growing. It's the right time to seize that moment and really think about how we can work better together for sort of achieve the optimal health outcomes for all three groups: humans, animals, and sort of our ecosystems. I'm going to talk a little bit about the One Health high-level expert panel and the work we've sort of been doing there, and in particular communicate how we've been conceptualizing One Health and how we're sort of streamlining our activities and the sort of advice and policy options we'll be providing to the partners who've helped constitute us. The partners being the three UN agencies, WHO, FAO, and UNEP, and the OIE. So why did OLEP come about, the One Health high-level expert panel? Well, as you know, we've had a number of these zoonotic disease outbreaks over the past sort of 20 years. We've had SARS-CoV in 2004, then swine flu in 2010, MERS-CoV in 2012, avian flu in 2013, the big Ebola outbreak in West Africa in 2014, and we had Zika in 2016, more Ebola outbreaks in 2017, and then of course culminating with the global pandemic of SARS-CoV-2 in 2020. So this has been a real driver for global leaders to get together and really think more expansively about why these kinds of events are happening and what more can be done across societies at the global level, at the regional level, at the national and subnational level to try to prevent these or mitigate their impacts. And at the Paris Peace Forum in November 2020, France and Germany sort of proposed that we should perhaps have a One Health high-level expert panel that can advise and provide independent strategic guidance to those partner organizations. And that's in a sense how we came to be. Who are we? We're 26 experts across the various disciplines, representing human health, animal health, environmental health sectors, and we're a geographically diverse and representative group. We've got representation from every single continent. There's a good balance between members from high and low middle-income countries, and of course, gender balance is an integral part of how we've been constituted. Our role is to support these international organizations, but also provide policy-relevant advice to national governments and authorities, and support global, regional, national One Health initiatives. How are we working? Well, we're divided into sort of 4 working groups. The first of these working groups is focused on a definition that we can all buy into and developing a theory of change that will support and help guide the activities of the 4 partner agencies as well as OLEP itself. That working group is also focused on identifying the best case studies of operationalizing One Health, because it's been around for a long time as a theoretical concept, but taking it up to scale, making it feasible and tangible and real for practitioners has always been a challenge, and that group is focused on that. The second group is focused on our current knowledge in the One Health space, identifying best practice, doing extensive network analyses, and trying to really map out who's doing One Health and where across the world, and what areas of focus these different networks have taken up. The third is focused on surveillance, because a lot of this is about shifting the paradigm of disease detection and response upwards to preventing and detecting it at source in wildlife before those spillover events take place. And so what is OLEP's mission? It's providing that policy relevant scientific assessment on the emergence of health crises arising at the human animal ecosystem interface, identifying research gaps, and supporting the guidance and development of a long-term strategic approach to reducing the risk of zoonotic pandemics, specifically developing an associate monitoring and early warning framework, and identifying the synergies needed to institutionalize and implement the One Health approach, including in areas obviously that drive pandemic risk. But there's more to it than that. Of course, if we want to achieve an outcome specifically around pandemic prevention, detection, and response, we also have to look at One Health more holistically, understand where the approach has been shown to be most effective, and not limit it simply to the prevention of zoonoses with pandemic potential. And so we've been looking at a more holistic definition of One Health. And OLEP has reviewed all the definitions that have been out there. There's over 40, between 40 and 50 definitions that were reviewed. And really, they all come down to two concepts that need to be communicated. One is that One Health is an integrated and unifying approach that recognizes fundamentally that the health of humans, domestic and wild animals, plants, and wider environment are closely linked and interdependent. So that's the first element of that concept. The second part is that the approach itself mobilizes multiple sectors, disciplines, and communities at all levels of society to work together to tackle these threats to health and ecosystems, while being cognizant of our collective needs for healthy food, water, energy, and air, and promoting sustainable development. So it really hones in and identifies both co-benefits, but also trade-offs in the actions we take. And that's really, I suppose, the new element to this. Previously, a lot of programs have looked at outcomes, but haven't really considered co-benefits or the trade-offs of potential actions. And I think that's going to be that's the real step change in the way that One Health is being approached now. And it has this more holistic attitude and really considers co-benefits and risks and trade-offs. And so One Health, as far as OLEP is concerned, is defined in this way, but it is underpinned by certain principles as well. And those are really important and need to be reflected and monitored and evaluated in whatever activities are then subsequently undertaken. And those principles can be broken into sort of five things. Equity between the sectors and disciplines, so that's between animals, humans, and environmental sectors. That there's socio-political parity, which means that all peoples are equal, deserve equal rights and opportunities, and there's the inclusion and engagement of civil society, of communities and marginalized voices, especially around the prioritization of issues that are then taken up or invested in. That we're seeking to achieve a socio-ecological equilibrium that seeks a harmonious balance between humans, animals, and the environment, and acknowledges the importance of biodiversity, access to sufficient space and resources, and the intrinsic value of all living things within the ecosystem. So it's not just about the value and lives of humans. It also recognizes that there's a stewardship function, and as humans are the apex living organism in the world, though you can argue against this, given that we've been brought to our knees by a microscopic bug. We still think of ourselves as the apex living creature in the world, but with that comes the responsibility of humans to adopt sustainable solutions that recognize the importance of animal welfare and the integrity of the whole ecosystem, and doesn't just think about this current generation, but thinks about the needs of future generations as well. And then finally, transdisciplinarity is the hallmark of One Health approaches, and that multi-sectoral collaboration, which includes all relevant disciplines, but also increasingly includes both modern and traditional forms of knowledge, and is inclusive of a more broader array of perspectives. So I think those are the sort of fundamental principles and values that are underpinning the approach. And One Health is essentially at an activity level framed by 4 C's, what we call 4 C's. There's coordination, there's collaboration, there's communication, and the fourth now that's needed is capacity building across the sectors. And that's how we're thinking about our theory of change. That'll be framed around activities that are fundamentally linked to those 4 C's. What are the outcomes of interest? Of course, for OLEP, it's about improved cross-sectoral capacity to prevent, prepare for, and respond to public health emergencies and health crises, especially pandemic threats, zoonoses, and public health events of unknown etiology. But also, when coming to the equity angle, there's the improved stewardship and equitable access to diagnostics, vaccines, therapeutics, and other technologies for the control of human, animal, and plant diseases. We also look at improved food safety and food and nutrition security for humans through sustainable livestock, aquaculture, and agricultural development. And one of the other important outcomes of interest for us is equitable access to clean water and essential micronutrients for humans, animals, and ecosystems. Alongside this, we're going to be looking at improved ecosystem management, including wildlife, biodiversity, energy security, rural and urban development, because all of these things are drivers and risk factors for zoonotic spillover events. So that, in a sense, should give you a flavor of just how expansive OLEP's work is, even though it is focused on preventing the spillover events or building capacity in order to do so. Within the animal health challenges and drivers that have been identified, our areas of focus are, at the moment, it's not all finalized, but we're going to be looking at spillover emergent events, changing animal migratory patterns, bush meat and wildlife trade, animal products, food systems trade, species extinction, intensified aquaculture and livestock systems, the introduction and the impact of non-native species in new systems, in new ecosystems, animal welfare, and shrinking wildlife corridors as well. So there's a lot in there for us to get on and do. And in order to sort of organize our thoughts and activities, we're thinking about three streams of inputs or activities. One is around the science and evidence base development, the knowledge exchange between the sectors, and continuing education at all levels of society. So this is, when should we start thinking about this concept of interdependence at school, at primary school, at secondary school, at university level. The second stream is socio-political engagement and advocacy. And then the third is building operational capacity. And I'll end there, but those are our three streams of activities, and that's what we're seeking to develop. So thank you very much.
Thank you very much, Osman. That was great. I think it was really good to hear about, how you're seeking out best practice and looking at the different working groups, and also the inclusion of equality and human rights in there as well. I think we have Juan back with us now. So Juan, can you hear us?
Yes, I apologize. I'm not too sure what's happening in rural Italy, but I'm sure it is instabilities with the internet.
No problem at all. I think we're running out of time a little bit, so we may have to move on to the next speaker quite rapidly. If that's okay. Thank you.
Most certainly. So may I call on Dr. Akunzule to please share with us his experiences from Ghana.
Okay. Dear colleagues, thank you for this opportunity. As you know, considering that rural communities are hotspots with high risk for zoonotic disease spread over to humans, with multiple implications at the local, national, and regional levels, rural communities are also focus areas for food production systems worldwide. With these characteristics of rural communities, it is very important to understand the dynamics of the interactions between humans and animals at the community level. At the community level, what health is important. According to the 2022 population census in Ghana, 42.65% of the population in Ghana live in rural areas. And by the USDA country survey in 2016, 58.1% of the children are in rural areas. In this regard, One Health is an important factor in sustainable development in rural communities in which people secure their livelihoods through farming, hunting, harvesting of forest products. People also share water sources with domestic and wild animals. That's what we call Babesiama monkey sanctuary in Ghana, where the monkeys live with the people and drink the same water sources and even sleep in the same rooms with the people. They also share homes with these people, and which are reservoirs of zoonotic diseases. It is also interesting to note that in Ghana, there are some communities share boundaries with natural plants and protected areas, which have constant interaction with wildlife, wild birds, and environment. It is also important to note that traditionally, some rural people have beliefs in trees, stones, and the rivers, and therefore they sometimes this shows the link with the environment, the human being, as well as animals. Now, the second slide we will talk about the second slide. We will talk about one will ask how animal health and welfare standards contribute to sustainable development in rural communities. These contributions can be reflected in the lives of the people as food and livelihoods, for which the VWD and in rural communities in the case of poultry farmers or livestock farmers in general, on good husbandry management, health management, good housing, proper feeding, disease prevention. We just mentioned few of the things that we conduct. VW cabinet also try to work in communities to improve health animals, to ensure what we call improving health animals to improve community public health. We also provide improved livestock protection systems to minimize disease outbreaks. These factors contribute to the socioeconomic development of the people because they have health animals to use for their needs. And then also the products or the manure from animals are used for crop production. Contribution of the animal health sector also strengthens resilience to climate change by providing alternative livelihoods and crop sales or when there's natural disasters. It's also noted that good animal health production, animal health systems also protect the spread of zoonotic diseases as well as non-zoonotic diseases. We have to also consider the other aspects of the animal health system. Slide 4. Slide 4. Okay. That communities also have a system to judge the effectiveness of prevent disease outbreaks in communities. To this end, it must realize that in Ghana, animal health system is faced with the problem. One, dwelling numbers of animal health workers. That country has currently 63 veterinary officers as compared to required number 683 first time. This shortfall has made disease reporting in the communities very difficult. Also, we realize that communities, the health, animal health services and animal clinics are mostly concentrated in urban areas. This is maybe due to the poor network coupled with increased seasonal tendency to flooding. Animal health workers, the community level, have poor access to telecommunication services, and therefore, even in some communities in Ghana, you have to climb on top of a tree sometimes to have access to communication. So, in this respect, you cannot effectively report animal diseases to the veterinary authorities. There's also inadequate access to veterinary service, lack of equipment, lack of vaccines for effective and safe delivery of vaccination programs. And then there's also inadequate skilled workforce at the rural community level. So these have a profound effect on the delivery of animal welfare. But we also have the next slide will be the need. These are posts that I have from people that we did not receive any human health service. And because of that, our fowl, pigs, sheep, and goats all died in the community last year. This is from the Dover Women Association. When I needed health delivery care for my pigs, there was no animal health care and all died. From 2021 to 2021, there have been 69 poultry farms that are affected with the avian influenza, with 52,940 pairs that died naturally, and 127,025 bears that were depleted as a result of the bird flu outbreaks. This is testimony to show the weakness of the district. Okay, now we go to the need for we need to train community animal health workers.
Dr. Zule, it's a bit difficult to hear you at this part of your presentation, and time is running. Can you put the microphone a bit closer, and can we try to move quickly through the remaining slides, please?
Okay, last slide. Okay. Therefore, last slide is not the last slide. We have so veterinary doctors in the system. Now, to make things happen for the animal health sector, we need to train community animal health workers with the animal health telehealth program, in which the Ghana Poultry Network and the VWB are to train 90 community animal health workers in the next 7 years. We also need to have strong policy advocacy and proactive dialogue on One Health for opinion leaders, pastors, and teachers at the community level. We need to improve One Health infrastructure, veterinary clinics, mini veterinary shops, and health centers. We need to also improve incentives for animal health workers that will want to work in the rural communities, because in Ghana, some animal health workers and veterinary service personnel do not want to go to the rural communities. We need to also improve farmer extension linkage. Finally, we need to improve funding for animal health systems, e.g. at the rural, what we call rural budget allocation for animal health. In conclusion,
Dr. Akunzule, we've lost your voice. Will you put the microphone closer to you and your final message, please?
Okay, my final message. In Ghana and the West, in Africa, where majority of the people and livestock with limited access to animal health services. To mitigate the deteriorating animal health system in developing countries, governments and development partners and philanthropists need to invest significantly to improve the animal health system and welfare for the well to achieve the UN Sustainable Development Goals. Thank you. My recommendation.
Thank you, Dr. Akunzule. We had trouble with the audio, but luckily we do have your slides with some of the conclusions there, and hopefully during the question and answer, if we have time, we would be able to reiterate some of those important messages. Now let me turn over to Dr. Professor Prasad, speaking to us from India. Again, please, we have some 5-6 minutes for your presentation.
Hi, good evening to all. My topic is operationalizing One Health and with special the animal health. We know that next pandemic is imminent with the outbreak of animal species by the zoonotic viruses that circulate among the animals. And we know 1.7 million viral species are circulating among wildlife, and 50% of these have the potential to cause human infections. Human wildlife conflict is there. In the picture I am showing, I have taken this picture from Friska Tiger Reserve, where buffer zone is there, but frequent movement of animal and domestic animals and human beings are there. And that's why they are sharing the grazing area and the water sources, which is source for transmission of the infection from wild to domestic animals and vis-a-vis to human beings. And we know that India suffers a loss of 20,000 crore rupees per year due to diseases infecting livestock. The diseases in cattle and buffalo account for 95.6% of the total losses occurring due to brucellosis, which is also a zoonotic disease in livestock population. Many other factors like socio-environmental factors also for emergence of novel viruses and pandemics are responsible. And these are continued wide-scale changes in the land use, transformation of agriculture sector without adequate biosafety, climate changes, trade and travel, then unplanned urbanization, development activities direct deterrent to the biodiversity substances. Other factors are also playing role in the spread. The main objective for One Health are the improved national capacity for zoonotic diseases for prevention, detection, and uh, and improve joint coordination and collaboration between major stakeholders for control of zoonosis. To achieve these targets, focus action on human, animal, agriculture, environmental interface is required for prevention, detection, and responding to the public health events that influence human and animal health and the environment. 35 veterinary and 1 wildlife institute versus more than 390 medical colleges prevalent in India, and this is the huge disparity for veterinary side. Compared to network 1.9 lakhs health institutions in government sector, only 65,000 veterinary institutions are there across India. So this needs to improve fast to address the One Health concept in India and for the art. Some barriers in the One Health approach which we recognized are the under-recognition of economic and health benefits, then fragmented and disconnected governance of health, animal health and environment, absence of an agreement between policymakers and professionals on way forward, inadequate joint training and capacity building activities, lack of clarity about the concept and scope of One Health approach, understanding of definitions, paucity of data for interaction between human, animal and its complex implications. And this is the slide showing the Ministry of Fisheries, Animal Husbandry, Department of Animal Husbandry, and just action taken recent development in this ministry, that livestock sector. And for disease control, the aim is reducing risk to animal health by prophylactic vaccination against disease of poultry and livestock, capacity building for veterinary services, disease surveillance and strengthening veterinary infrastructure. And the recent major activities are the critical animal disease control program for eradication of the rinderpest and the classical swine fever, which is economically important diseases. Establishment and strengthening existing veterinary hospitals and dispensaries, and including the mobile veterinary units. Assistance to state for control of other economically important exotic, emerging and zoonotic livestock and diseases. And good part is that there is 100% funding from the central assistance for the CADPC and non-recurring for the ESVHP. 60:40 ratio between the central and state for the other components as well for the SCAD schemes, and with 90:10 ratio for hilly and northeast states and 100% for Union territories. So this is very good news for India for the One Health for animal sector. Strengthening the animal health would fill up the significant gaps such as availability, reliable data on the size of veterinary workforce, and adequate training of animal health practitioners in live and international standards, good understanding of what constitutes essential medicine and their availability, strong surveillance system, good stick disease spread from infected animals to the healthy ones and ones also, sufficient financing of animal health and care services, good access to veterinary services among animal owning communities. The One Health approach supports global health security by improving coordination, collaboration, communication, and the human-animal environmental interface to address shared health threats such like zoonosis, antimicrobial resistance, and safety, and many other issues. And recommendation to the government are to increase the animal health workforce, efficiently animal health system to deliver healthcare service to animal and their owners, more funding, budgetary allocations for One Health, especially for animal health and environmental health to combat zoonosis, reduce the gap between veterinary medicines and vaccines, vaccination campaign to control zoonotic diseases, improve animal disease detection, surveillance and management system, enhance the multilateral collaboration on health, and support community education and engagement. Thank you very much for your attention. It's a lot. Thank you.
Thank you very much, Dr. Prasad. It looks like with a very complex society and numerous society in India, to be able to manage all these parts together is a difficult task, but you have great experience in doing so. Hopefully, being able to get the different sectors not on paper, but really for action on the ground to improve the health of millions, if not billions. Some of the numbers that you shared with us reflect very much what Dr. Samshin was also sharing about. are we happy with the animal health or lack of animal health in our planet? And I would say no. So let me move on quickly to Mr. Naeem Abbas, speaking to us from Pakistan.
I would like to share an example of One Health. There is an area which is called bricklin industry in South Asia, and it has 150,000 bricklins. And in this industry, there are typical issues of human health, animal health, and environment. And if we look into go for the overview of the industry, I will quote an example of Pakistan. There are 20,000 bricklins in Pakistan, and they produce 82.5 billion bricks annually. There are 200,000 animals being used to transport bricks within the bricklins, and there are 1.3 million people working in this industry. And if we look into the human health related issues, the data says that 80% workers have no running water, 82% do not have proper drainage, 60% have no latrine facilities, 60% workers live below poverty line, 57% women gave birth within kilns, and 22.4% workers had chronic cough. If we look into the animal health issues, we can see that there are 50% animals with hoof problems, there are 30% animals with wound issues, and 52% have abnormal gait, 40% with spinal pain, and 16% with eye problems. If we look into the environment side, the average coal consumption in this industry is 13 million tons. 13 million tons of coal is annually being consumed over here, and that is out of 100%, it is total 60 to 70%. The other 30 to 40% are other fuels like plastic, rubber, and many other harmful fuels. And another one linked output is here, like there are related to human health. There are premature deaths and morbidities due to air pollution cost Pakistan up to 6.5% of its GDP annually. This is World Bank's data. And we can see that human well-being in this whole side is interconnected with animals and environment, because humans and animals are working in very close proximity, and the environment is having an impact, direct impact. So we have adopted an approach as an organization, and that is that a cross-sectoral, multi-stakeholder civil society forum was required, and we are working on that. And this for this working group, there are the following requirements, like first of all, effective policy and legislation to improve occupational safety and health, minimum wages, and veterinary care services in this industry. Number two, technology adoption is required to reduce emissions, human and animal labor workload. And number three is livelihood improvement initiatives must be introduced to ensure labor force is able to take care of the health of themselves and their animals. And we also recommend that there is a strong need of evidence generation in this industry. We, as an organization, initiated this consultative process at South Asia level, and we held 2 consultations at South Asia level in Nepal, where we, along with other partner organizations, hosted these consultations, and some international, national, and international regional organizations joined us over there. And the organizations concluded that there is a dire need of One Health approach. One challenge has been observed that organizations are usually working in silos. Bricklin industry alone has multiple issues, and there are multiple departments and multiple government institutions and private institutions are looking into every single component. And that is one of the best examples where inclusive approach needs to be adopted to create more coordination and avoid duplications. So as the last thing we recommend is that if there are strong animal health systems, the human health will be improved. examples are here, like death and sickness of an animal leads to bondage and forced labor, because the people, the labor who keeps working animals, they borrow money to buy these animals and they are already in the debt. So if the bondage leads to low wages, if I'm bonded, I cannot bargain on my wages. I'll be given wages, whatever they want. Low wages leads to food security issues, incapability to respond health emergencies, low or no access to healthcare services. Psychological health issues will be there. And, you know, improved veterinary health services can reverse these things, and if the animals are protected, all these issues will be reduced. So we strongly recommend that the G20 need to allocate resources on animal health systems. Thank you.
Thank you very much, Naeem Abbas. That was a very, very comprehensive picture, and bringing in very much the environment into we're talking about environmental contamination with your example of the kilns. I also question, I know in living in Italy, I know that most of the bricks that are being imported here are coming from Bangladesh or Pakistan. So I think the international trade aspect and the responsibilities there also picture this problem not only as in rural areas of Pakistan, but also what the global community is contributing to your local problems. The psychological, emotional, it's not only about infectious diseases, it's so much more. So I thank you very much for such a comprehensive presentation and the good work that the Brook is doing there. So thank you all for joining us today. I'm sorry that we've had some technical difficulties with audio and with me being leaving and not being able to come back, and also the time constraints. We've had numerous questions that have been posed to us on the role of animal health, importance to society. I will only be able to maybe touch on one or two of them, but for this one, for Dr. Dar, let me ask you this question about coming from Terence Scott. Okay, please turn off the PowerPoint. Thank you. It seems a lot of focus for One Health implementation. Excuse me, I lost my ability to see the question. It seems a lot of focus for One Health implementation is based on pandemic response and emerging infections. What are the objectives for endemic diseases, and what action is being taken to address these endemic diseases?
So I think that's so. Thanks for Juan for that question. And I think that, you know, in many ways comes to the nub of the situation we see at the global level. A lot of the driver for a really important driver for what's happening at the global level and the push around emerging infections, as well as some aspects of antimicrobial resistance, if we're fair, is this idea of health security, and particularly national health security when you're talking about the big powerful donors and bigger, more wealthier states. And of course, for them, the issue is about emerging infection risk and, you know, the potential for pandemics. But really, even if you're thinking that way, and it's about self-interest from a donor or wealthier country's perspective, you have to think about what keeps those capacities sustainable in low and middle income country settings where these spillover events are more likely to occur. And that is a focus on endemic diseases. Those are bread and butter issues. Those need to be prioritized. And that's why in OLEP, we're very sensitive to that if you want sustainability of capacities and investments that are made to address emerging infections, you have to put in adequate investment around endemic diseases, neglected tropical diseases, because really those are the bread and butter issues of communities at the local level. That's what's affecting them. And many of the capacities you build, a lot of the technologies are cross-cutting, whether you're using them to control endemic diseases or whether you're using them to prevent spillover emerging infections. So we've got a whole track around that, and we're making sure that within the global action plan on One Health, there's a separate track for endemic and neglected tropical diseases, and we're hopeful that the investments in those areas will be forthcoming, because we're linking it fundamentally to sustainability. I mean, if donors want people to continue and sustain this with their own resources, they have to be open to everybody being part of the conversation when it comes to prioritization and the allocation of resources.
Thank you, Dr. Dar. One of the key messages to the G20 is the importance of the need to invest in animal health systems to operationalize One Health. We need to strengthen those weaker links and to safeguard the planet and tackle the threats at source. So this, I think, it brings in light to what we are talking about, endemic diseases or these novel pathogens as they may emerge. So it's a systems approach. So we only have 4 minutes left. If you were on the elevator, what would be your key message to the G20 ministers of health or minister of finance or the prime minister or the president? Let me begin with Dr. Akunzule, your one thing that you would say on that elevator. Take off your mute, please.
Development partners should increase funding to local non-governmental organizations to support One Health and animal welfare initiatives at community level.
At the community level. Yeah. Absolutely. And I think with education, to something that Dr. Adad had said about education happening, starting in the primary school, not waiting for the PhD. Professor Prasad, what would be your one message in that elevator? Can you take off your mute button, please? Sorry.
Yeah. And so my message is that we have to take care of animal health and environmental health, because these two are contributing factors for human health. Because either directly or indirectly through food and milk products. So these should be taken care of, because they are the main source for transmission of infection, zoonotic infection specifically. And wildlife is another factor which are we ignoring these days. So it should also be taken into consideration. Because in the coming years down the road, 10 years down the road, all the infections are coming from wildlife, because we have urbanization with the very high speed and cutting the forest, and the resident of those forests, they are coming closer to the human community, and that's why they are sharing the infection to the humans, because human beings are live for those type of infections.
You're absolutely right, Professor Prasad. I think that encroachment aspect is very, very important in how we treat our environment. And animal health encompasses wild and domestic animals, those that are terrestrial or aquatic or even aerial, such as bees, which are so very important in their role as pollinators for crops. And they're also indicators of our ecological changes. Let me end with Naeem Abbas's key message on that elevator.
I'll repeat the same message, that please invest on animal health systems if you want to ensure human health. Okay.
Very, very well. We've come to the end, and we have maybe 45 seconds more of, and I'm sorry that we were not able to entertain all your good questions because of the time constraints that we've had. But I thank you all for joining us, and to all the members from the Action for Animal Health Coalition that were able to gather us today. And I wish you a very, very good end of the session, and please be responsible stewards of our planet. We only have one. Thank you.
Thank you, everyone. Bye.
Thank you very much. Bye-bye.
Thank you. Thanks for coordination.